Hi everyone, I'm Dr. Karam, board certified facial plastic surgeon. I specialize in facial rejuvenation, which basically means I help people look as young as they feel. And today we're going to talk about a very important part of looking as young as you feel, and I'm going to talk to you about how I rejuvenate the eyes. My approach is somewhat different than the classic way of treating upper eyelid blepharoplasty, lower eyelid blepharoplasty. I generally think of everything in a comprehensive way, and I'm going to give you the reasons and the rationale why I believe that is an important way and a more successful way of treating the periorbital region. We're going to talk about the periorbital frame and what are the components that make up that region. We're going to talk about the aging of the periorbital region. We're going to break it down into the upper eyelid region, lower eyelid region, and the temples. We're also going to talk about the combination of excess and deficiency and how that balance creates the tired look. And then finally, we're going to talk about putting the procedures together to ultimately give the most rejuvenated and most natural looking outcome to brighten the overall appearance and make you look as young as you feel. So without further ado, let's break it down. There's a lot of value in understanding that the periorbital region is the target of treatment. And it's not the components of the periorbital region, which I will break down and discuss in a moment, but it's the entire region. So the argument for a comprehensive approach and why I take that approach with my facial rejuvenation and eye rejuvenation cases is because of that very reason. So what are the components of the periorbital region? So there are a number of things that are involved in this area. So let's start from outward in. So outward, you've got the temples, you've got the eyebrow, you've got upper eyelid skin, you've got lower eyelid skin or fat pads or bags, right? And going slightly lower, you've got the orbital rim of the lower eyelid, and then you've got the cheek. So all of that together becomes the periorbital frame. And each of those components contribute to the aging process. And addressing them is extremely important if you want a beautiful, rejuvenated outcome. When we look at each other, we as humans are looking at one another in this space. You know the comment, look into my eyes, or it's important to make good eye contact. Well, we've been trained to interact with one another using good eye contact. And in order to make good eye contact, you're looking at each other in the upper half of their face. Now, the upper half of the face says a lot about how we're feeling. It tells us if we got great sleep, it tells us if we're, aging, it tells us if we're looking angry, if we're looking happy, if we're looking well rested, if we have energy. There's a lot of things that our eyes can tell. So let's talk about how that area ages. The aging of the periorbital region is pretty common and it's pretty ubiquitous. So basically, starting somewhere in the late 30s, early 40s, we start to see changes happening in that area. And what are those changes? There are changes that are causing the tissues to become excessive, and then there's changes that are causing a loss. The periorbital region has a variety of fat pads. The temporal fat pad, the suborbicularis oculi fat pad, which is the acronym is SUF, and then you've got the retroorbital oculi fat pad, or the upper eyelid fat pad, otherwise known as the roof. And all these areas together basically have a consistent loss of volume happening at the same time. So you're losing volume in the temporal region, you're losing volume in the lower eyelid region, you're losing volume in the area above your brow and your upper eyelid region. So all that volume loss creates a skeletonized and bony look around the eyes. Then there's another combination of things that are happening, and that is things are becoming droopy and excessive. The corner of the eyebrow starts to come down a little bit. There's excess skin in the upper eyelid region. There's excess skin or puffiness coming out of the lower eyelid region. And when you look at all that together, it follows the general theme that with aging, things start to get elongated. Tissue starts to expand and get longer. So in the upper eyelid, that extra skin becomes a term called dermatochalasis, which just means extra eyelid skin. Same thing with the lower eyelid. You see extra skin forming here, but in some cases, you see puffiness starting to happen. And so what causes puffiness to the lower eyelid is actually kind of an interesting point I want you to understand. It has anything to do with weight gain or weight loss. The reason why lower eyelids become puffy in some people is purely a genetic way some people age around their eyes. And what you're seeing in the eyelid anatomy is on the outer part of the eyelid, there's skin. Next layer is muscle. Below that is a layer called the septum, and below that is the intraocular fat. And the intraocular fat basically is the cushioning of your eyeball, believe it or not. Your eyeball sits in your socket, but if there wasn't any fat or cushion in there, your eyeball would be bouncing around bone, and that wouldn't be good. So the entire eyeball is surrounded with an area of fat, and that fat, as we age, in some people, where the septum starts to weaken, the fat pad starts to push forward and you start to get a bag. So it's not because of actual excess, it's because of the weakness that happens at the septum. And the septum weakens as the septum gets longer and the strength of that wall becomes weaker. The fat pad over time starts to push forward and you get bags. Now, there is a very important anatomic relationship that I want you to be aware of, and that is called the eyelid-cheek junction. And when you look at the eyelids on profile view or even on front view, if you take a line at the level of the eyelash and you go down to where the cheek starts, that distance is called the eyelid-cheek junction. In young people, that eyelid-cheek junction is short. As you get older, that eyelid-cheek junction gets longer. There's a combination of things that are happening to cause that. One is loss of volume. Remember, the loss of fat pad in the infraorbital region increases the height of the cheek. It basically causes the cheek to run from the eyelid all the way down to the actual cheek. When you lose that fat pad, all of a sudden the cheek begins below the eyelid orbital rim. Now this is super important because one of the key factors of why somebody looks tired or older is the increase in length of the eyelid cheek junction. So pay very close attention to the before and afters that we'll show later on to see how that eyelid cheek junction has shortened. I'm going to take a moment and explain the importance of the lateral brow region. The lateral brow area, the corner of the brow, is basically floating in this area. So what ends up happening is we lose volume and the fascia underneath the tissue start to get longer. It pulls this corner of the brow down and you start to see hooding happening in the corner of the eyelids. A lot of people make a mistake. They think that that hooding is related to the eyelid skin, where in fact it's related to the hooding of the corner of the brow. If you go in and mistakenly take out just eyelid skin, you're actually pulling the lateral brow down. This is why this is so important. You actually have to, in those cases, address the lateral brow by elevating it and putting it back up into position so that that area directly and specifically opens, and then you just remove the extra eyelid skin. This is a very important component. A lot of people make this mistake surgically and patients end up paying the price for it. So understanding this relationship is extremely important. When I look at the periorbital region and I'm planning how to surgically address this region, I'm looking at all of the components I just mentioned. I'm looking at the volume status of the periorbital area, which is the temples, upper eyelids, and lower eyelids. I'm also looking at the amount of excess skin in the upper eyelids. I'm looking at the presence of excess skin or fat pad in the lower eyelids. And I'm also looking at the position of the corner of the brow. Evaluating all these areas together, you're going to form a checklist. You're going to say there's ptosis of the lateral brow. Ptosis just means that the lateral brow is coming down. There's excess skin in the upper eyelids, extra skin on the lower eyelids, and there's loss of volume, or any combination of those things. When that happens, it behooves you to address them in totality, in combination, in a comprehensive way. Otherwise, you're going to end up with a sort of half-baked look. You're going to have upper eyelids that look tired, lower eyelids that look refreshed. You're going to have a brow that's hanging down and that's covering up anything you do on the lower eyelids. And then the overall net effect is now you're going to look super bright and fresh, which is ultimately the goal. So recognizing that the eyelids are involved together allows you to create a comprehensive plan. So now let's talk about how to address the periorbital region in a successful and comprehensive way. What are the treatments for each of the areas that are involved? So number one, upper eyelid skin is treated with an upper eyelid blepharoplasty. It's a simple technique where the incision ideally is made in the natural eyelid crease and the amount of excess skin that is present is pinched marked and removed. That's an upper eyelid blepharoplasty. In my practice, in my hands, I will never take out eyelid fat. That's a pretty traditional approach where you're taking out muscle and fat in the upper eyelid, which actually ages the upper eyelid. And this was a very common way eyelid surgeries were done, and very, very, in my opinion, counterintuitive to how aging happens normally, because you lose volume anyway. I'm gonna pause again for a second and explain something really important. No one wants their eyelid shape changed. This is a very, very important thing that people request and are afraid of as a result of eyelid surgeries. If you don't purposely change the shape of the eye and do the things that I'm explaining right here, the eyelid shapes will never change. And as you go through some of these before and afters in a moment, you'll see that the eyelid contour, the eyelid shape has not changed. It's just the components of aging have disappeared. And the reason is the canthus, the relationship of the eyelids to the bone, that has to be disrupted or manipulated in order for the change to occur. And in general, it's generally speaking not necessary using the principles that we're talking about here. Although some surgeons may disagree and do that routinely in their eyelid blepharoplasty cases. So, upper eyelid skin, upper eyelid blepharoplasty. Lower eyelids, if you have extra skin, I perform a technique called a skin pinch. Same idea as the upper blepharoplasty, just remove the extra skin. The incision is made in the infratarsal crease, which basically is a horizontal line that runs in the lower eyelid. And the incision is made there, heals extremely well. If you have extra fat that we just talked about, the fat pads is pushing forward, I will do a transconjunctival lower eyelid blepharoplasty, which means I go from the inside of the eyelid to remove that protruding fat, and as a result, it decompresses and it doesn't put as much pressure on the eyelid. I will always generally combine that with a skin pinch, because it's rare that in an aging process somebody has excess fat pads but doesn't have extra skin unless they're a little bit younger. Now, that takes care of the eyelids. Now let's talk about the other areas. If the corner of the brow is ptotic, you gotta do a directed lateral brow lift, which just simply means we elevate the corner of the brow. In my practice, I make the incision at the hairline or just behind the hairline, and I elevate and remove the excess skin and tighten up the fascia that might be causing. This is a relatively unique procedure. I do this as part of all of my vertical restores, but I will do that separately as a part of eyelid rejuvenation if the lateral brows are hanging. I personally am not a huge fan of endoscopic eyebrow surgeries, where it lifts the entire brow, because I don't like the surprise look. I have a very natural orientation. I don't like a surprised and altered effect. Lateral brow lifts, generally speaking, don't create that as long as they're done conservatively. This is the principal and most important part of the overall outcome, in my opinion. It's the use of fat transfer to restore lost volume. Now, I'm gonna just take a quick side note and say that in my opinion, eyelid surgery without fat transfer simply doesn't get the job done. And it doesn't take long to look at before and afters and cases where fat transfer wasn't done and recognize that it really doesn't create that rejuvenated, rested, and fresh look. Fat is the reason why that happens. So where's the fat placed in these cases? Fat is placed in the infraorbital region, it's placed in the upper cheek. And usually when I do a fat transfer, it's done comprehensively. So it's not just that I'm putting it here, I'm putting it a little bit throughout everywhere, but in the periorbital frame, this is where it goes. Under the eyes, it actually goes above the eyelids, it goes into the temples. Even in some cases, the actual eyebrow has lost some volume, we put a little bit in there. And feather into the cheeks. And if, of course, the lower face needs a little bit, we'll balance it out that way. But the combination of fat transfer, upper blepharoplasty, lower blepharoplasty / skin pinch, and a lateral brow lift are the 4 tools that are used for periorbital rejuvenation. And at the end of the day, if the goal is to look vibrant and fresh around your eyes, there is no better way than to do it in a comprehensive way so that everything is balanced, harmonious, looks like the parts belong to one another, and at the end of the day, you look younger like you did when you were actually younger. So that's the kind of simple-minded approach, is you want to go backwards in time by reversing the aging changes that got you here in the first place. So as we zip through and look at some of these before and afters, what you see is the eye shape hasn't changed, the essence and the look of the person hasn't changed, but what you see in them is that the eyes look more rejuvenated, they look more refreshed, the components that we just talked about are all eliminated, and that there's a cohesiveness and balance to the overall outcome. And that's what I really love to see in the outcome of the before and afters, is that no one looks different, and they look rested and rejuvenated, and they feel comfortable in their own skin, which is an important thing, because once you start changing the shape of the eye, all of a sudden you feel less like yourself. So these are the basic results of this approach, and as you can see, it looks beautiful and natural. Guys, I hope you enjoyed this little tutorial on how I perform eye rejuvenation procedures, my rationale, and ultimately, that hopefully you agree that the results speak for themselves. If you haven't already, make sure that you subscribe to this channel so you can see more content like this, and share this with any friends and family so they can become educated and have a better position of discussion and searching when they discuss this with their surgeons. And ultimately, if you like this content, make sure you hit like. And if you have any questions whatsoever or any comments, just drop them down in the comments, and I will do my best to get to them one by one. I know there's a lot of questions and interest in this particular topic, so feel free to drop it. And there's other videos like this that we discuss, overall facial rejuvenation and how eye rejuvenation fits into the overall outcome. But just think volume and laxity combined is how you're going to address this entire area. Guys, thank you so much. Dr. Amir Karam, until next time.